This is the epicentre of India's COVID crisis, the worst hit city in the worst hit state. Here at a wholesale food market, work must go on as the virus continues to silently spread, infecting residents at record rates.
I am worried about contracting the virus, but poor people like us can't sit at home. We'll starve to death if we sit at home.
There are partial lockdowns and an evening curfew in Nagpur, but it hasn't been enough to bend the curve. 1 in 3 tests are coming back positive.
In spite of having a better knowledge of the disease, in spite of having better treatment protocols, we are still in a bad shape.
To see the severity of the problem, we're going inside a COVID intensive care unit at a private hospital. I'm covered head to toe in protective gear before venturing in. The ward is at capacity. Nurses and doctors work tirelessly. The medical equipment is world class, but for some patients it won't be enough.
This is like a 78 years man who's unlikely to survive.
It's not just the elderly here. This woman fighting for life is only 33. She gave birth just over a week ago.
Now we have patients who are coming from all the age groups. We're seeing patients as old as 14 years old.
Doctors say they're in this situation because people acted foolishly after the first wave, with mass gatherings and poor COVID protocols. But there's something different this time. The virus is seemingly more aggressive. Relapses are increasingly frequent.
However, there are people who are getting reinfections. So probably there is some immune invasion happening here with this type of virus.
1 in 5 samples in this state are the newly discovered variant described by officials as a double mutant. It has the characteristics of 2 already identified variants. There can be a big gap between private and public hospitals in India, but even if you have the money to access the private system, there's no guarantee that'll help. This week, every single private hospital in Nagpur ran out of spare ventilators.
All the beds have been exhausted. Only if a patient succumbs, a ventilator bed is becoming available for those who need it.
In the public system, it's even worse, as COVID patients have been forced to share beds. Families wait outside this hospital for days to hear about their loved ones inside. The news can be grim.
Every ambulance or hearse that leaves this ICU building frightens us. We wonder, who is that inside? Is it our loved one?
Patients come here for treatment, but there are no beds available for them. Sometimes they cry, they beg, but they can't find beds.
Those suffering the disease have a simple yet important message.
Take all precautions, wear masks, sanitize hands regularly, and do not take COVID lightly.
India's vaccination program has been more about saving lives than stopping the spread. Only frontline workers and those aged over 45 can get the jab. Given the scale of the disaster, there's increasing pressure to open it up to everyone. But reported shortages in this state and others show that's easier said than done. James Oaten, ABC News, Nagpur.